Hi everyone, welcome back to the channel. In today's video, I'm going to show you how to use a stethoscope, one of the most essential tools for nurses, doctors, and medical students. Let's get started. What is a stethoscope? A stethoscope is a medical device used to listen to internal body sounds, especially heart, lungs, and bowel sounds. It helps clinicians assess a patient's condition quickly and accurately. Parts of a stethoscope. Before we start using it, let's quickly review the main parts. Ear tips. They should fit comfortably and point slightly forward. Tubing carries the sound from the chest piece to your ears. Chest piece usually has two sides, diaphragm or large side for high-pitched sounds like normal heart sounds and breath sounds, bell or a small size for low-pitched sounds like murmurs. How to wear the stethoscope properly. Many beginners make this mistake. Make sure the ear tips point forward, matching the direction of your ear canals. If they point backward, you won't hear anything clearly. How to use the diaphragm and bell. Use the diaphragm for lung sounds, regular heart sounds, bowel sounds. Use the bell for heart murmurs, low-frequency vibrations. Make sure the side you want is clicked into place before listening. Listening to the heart. Place the diaphragm on the left side of the chest. Listen for rate, how fast the heart is beating, rhythm, regular or irregular, heart sounds, locked up. If you hear extra sounds or murmurs, switch to the bell. Listen to the lungs. Ask the patient to breathe deeply. Place the diaphragm on the upper chest, left and right, middle chest, lower chest, and don't forget the back. You're listening for air entry, wheezing, crackles, any abnormal sounds. Common mistakes to avoid. Listening over clothes, holding the chest piece with your fingers, use your fingertips. No contact with the skin, using the wrong side of the chest piece, ear tips pointing backwards. How to take care of your stethoscope. Clean the diaphragm and bell after each use with alcohol wipes, avoiding exposing it to extreme heat. Don't hang it around your neck for too long. Your sweat can damage the tubing. Okay, thanks for watching. If you found this video helpful, don't forget to like, comment, and subscribe for more medical and biomedical engineering content. See you in the next video.